Hello everybody, welcome to this workshop from the Burdett Trust for Nursing. My name's Jane Dwelly, and today is your opportunity to find out as much as you can about how to make a successful application for a Burdett Trust for Nursing grant. The major grants program we're talking about today is Digital Health for Nurse Leaders and Nurse-Led Improvement Projects. So today we're going to talk through some parts about the grant process, and then later in the workshop we'll ask you to break into groups depending on what you're interested in applying for. We have 3 categories of grants this time, and that's going to be where you'll spend a half an hour this afternoon with a nurse leader and a digital health leader in one case, finding out about the best way to set the context for your grant application. So lots to go through, a packed agenda, so let's move on straight away. And I'd like to introduce Shirley Baines, the Chief Executive Officer of the Burdett Trust for Nursing.
Thank you. Hello, everybody. Thank you for joining this workshop today. We are excited by the huge response we've already had and are looking forward to getting many applications for digital health improvement projects. The Burdett trustees decided to focus on digital health for the next major grants programme because they saw how nurses were quick to use digital innovation during the pandemic to continue to care for their patients. We saw truly inspiring work from nurses everywhere in extremely difficult conditions. And this is just the beginning of what can be achieved. And the Burdett grants are designed to provide the kind of financial support that allows innovation to flourish. You know best what you need to make your idea come to life. And this workshop will give you some guidance on how to best explain this in a grant proposal. We've put some structure around the grant application process by asking for grants in 3 areas of digital health improvement. Grant holders will be able to network with nurses doing similar projects and share ideas. Building on this, grant holders will be supported throughout their project by the Change Agents framework, delivered in partnership with CHIME. We've built in this professional support package to help you manage your project to a successful conclusion with lasting benefits. And Jane will tell you more about that later.
Right, we're in.
Let's look at today's agenda. In a moment, I'll ask Dame Christine Beasley, former CNO for England and a Burdett trustee, to speak to you about the Burdett Trust for Nursing and its objectives. Then we'll send you off to a breakout room to meet a nurse leader who is an expert in one of the 3 topics we've identified. After that, at 4:20, we'll hear from Natasha Phillips, CNIO at NHSX, who will explain her vision for digital nursing and how your grants can play a part in her emerging digital strategy. Finally, Jane and I will take you through the next steps in the application process, the timetable, and the all-important password. Now, without further ado, over to Christine.
Thank you very much, Shirley. Good to see you all here this afternoon. Nurses are born innovators. Of all the clinical groups, nurses, midwives, and AHPs work most closely with the largest number of patients. And I think we would say true at every point in the care journey. This contact, I believe, gives them a unique understanding of how to make a positive impact to patient care. But as we know, life happens, and sometimes the system we work in creates barriers for us and we lose enthusiasm. In my career as a nurse, and right from the beginning of my nurse education, and when I later became a nurse leader, both regionally and nationally, I wanted to create a climate where innovation is able to flourish, to help people who have ideas, to get them working and to spread them. I'm delighted to be a trustee of the Burdett Trust and chairman of their grants committee. I'm delighted to be part of it because the Burdett Trust for Nursing makes grants in support of nurse-led projects, using its funds to empower nurses and make significant improvements to the patient care environment. Our grants focus on individual nurses or small teams who want to make improvements to patient care. Many of the people who we work with, but either as individuals or as teams, are at the front line, at the very grassroots of care. And I believe our approach to grant making makes resources accessible to nurses who otherwise would not be encouraged to start these kinds of projects. The value of each grant means it buys nurses the time and the resources. So often people have got ideas, but the day job is heavy, one's personal life is heavy, and there isn't time and space to bring those ideas to fruition. But having a grant from us can help you do that. It helps you to develop proof of concept with the hope of it leading to wider adoption in the nurses' workplace and ultimately in the wider NHS. We have a lot of experience where a small idea nurtured and developed has become a national project and then has spread internationally. In the COVID pandemic, we saw nurses use innovation, as Shirley said, to maintain care for their patients. They continue to work in extraordinary conditions on COVID wards and in the community, and now lead mass vaccination programs. I'm so pleased that Burdett can support emerging digital health projects. I'm so pleased that we've taken a slightly different view of having these workshops before we start, so we can get the very best, support you to do the very best you can, and get the very best we can out of the projects. I know each one will empower nurses, not just for their own sake, but because it's that leadership and that input that brings lasting benefit to patients and the community in which they live. So over to you, Jane.
So thank you, Christine. Great to hear from you, and great to hear about the context as to why the Burdett Trust for Nursing chose digital health as its major grants programme for next year. Before we go into our breakout rooms to talk about the actual cohorts that we will be applying for your grants in, I wanted to ask Shirley a few commonly asked questions about the grant process. I thought if we got those out of the way now, we would then have more time in our breakout groups to think about the work you want to put forward. So Shirley, tell us, what is the average value of the grant you'll be awarding under this programme?
Well, the grants awarded will be within a range. So you can apply for grants between 25,000 and 50,000. And, you know, it just really depends on each project, what sort of money the applicant is applying for.
Okay, that's good to know, thanks. And when the money is awarded to a successful application, who actually receives that cash?
Right, the grant is awarded to an organisation. The grant terms and conditions are signed by the organisation, and they are responsible for the grant, and the money is paid to the organisation. So obviously there's a project applicant, a nurse leader, but the grant is actually made to the organisation.
Good, okay, so that has to be borne in mind when you're making the application, that there's someone behind that organisation who will be able to receive the money and then manage the governance of that. And we'll have more on the governance of projects later on in the workshop. I've been saying all along this afternoon, they're nurse-led improvement projects, and this is the Burdett Trust for Nursing. So could you just tell us again why it's so important that they are fundamentally nurse-led projects?
So obviously the Burdett Trust for Nursing is a UK registered charity, and we have certain criteria that we have to fulfil. And one of those is that projects are nurse-led. The monies go for nursing projects, not medical projects, especially led by nurses.
Great. And one final question, and this comes up a lot, you'll be surprised, you won't be surprised to hear, what doesn't the money pay for? What shouldn't people put into their budgets?
So we're not looking at paying or awarding grants which will cover costs of hardware. So we're not looking at you know, iPads, computers, laptops, iPhones, that sort of thing. This is very much looking at obviously some costs of software, but staff costs and other costs, but not hardware. And then the other thing is we don't pay the overheads of an organisation. So what I mean by that is actually, you know, the costs of rent, utilities, etc. We do not cover that in our grants either.
Okay, and then so the kind of thing you would be paying for, just for example, would software be included in that if there's a software program?
Yes, it would.
And what about things like staff time or, you know, sort of ancillary things like that that help the project flourish?
Staff time or covering, you know, people backfill for nurses, maybe some consultancy, project managers. Yes, okay. Staff time.
Wonderful, thank you. Okay, before we move on to the, let's move on to the actual cohort groups now. And when you do your application form, you'll be asked to fill out quite a good length of application. And it starts with a 500-word question in which we'll be asked to set the context for your grant proposal and say why it's important and why it's important now. And that's what we're going to help you with in the rest of this workshop, is giving you some background into the 3 areas we've identified as grant application areas. So think about, you know, the local circumstances, what's happening in the policy world. Obviously, you've got a white paper coming up in England. So that's another thing to think about, and how that's going to affect the environment in which you're launching your grant work. So we're going to split you now into 3 rooms. I'm going to talk you through who are the nurse leaders and digital leaders in those rooms. So cohort 1 is interested in the use of data and analytics to measure and improve nursing practice and nurse-led interventions. And Maggie Lay, our friend from NHS South Central and West Commissioning Support Unit, will be running that group. Group 2 is leadership development for digital nurses and also talking about professional standards. Angela Reid will be joining us from Northern Ireland to talk about that and the work she's been doing on a competency framework. Angela's actually coming from another meeting. So Andy Kinnear, a friend of ours and a friend of CHIME, will start that meeting off for us. And in group 3, this cohort is patient-centred digital health improvement projects, and Tracy Eyre from Health Education England will be leading that group, and I'll be giving her support on that too. Now we're going to let you choose your own groups for these breakout rooms. Shortly you'll get an instruction to go into breakout groups. Any problems, stay in the main room and we'll help you. But we're just about to open the rooms now. You choose where you go and we'll see you there shortly. Thank you, everybody. And I hope that was helpful. I hope you found out plenty to support your work as you make your grant application. I'd now like to invite Natasha Phillips to speak. Natasha is the Chief Nursing Information Officer at NHSX, and she has been in post about a year, and she's going to talk to you now about what she's achieved in her first year and how your projects can help her as she develops a new strategy for digitally enabled nurses and midwives. So over to you, Natasha.
Jane, thank you very much. And it's really great to be here because I'm really excited about this opportunity and all the ideas that the people have in this room, and really sort of, for me, the cumulative effect of them all. If we think of the amount of the volume of projects coming together with a whole bunch of nurses innovating, there's real opportunity to use that to build the strategy and also to showcase what we're doing. So I do have a few slides. I will endeavour to share my screen with you. So I'm just going to do a bit of context of where we've come from and the journey we're on. I guess a bit about my personal journey along that way, and how we can use our collective leadership and creativity to shape the future for the profession and those who follow. So clearly there's quite a pressing digital agenda and a pressing digital nursing agenda. I'm not sure it's always so clear what the digital nursing element agenda should look like, in that it's fair to say that perhaps for many reasons, we haven't been able to really think about what would this mean for our practice as a collective, although of course some individuals will have. And I think we've seen through the long-term plan and the tech vision, and then what's happened with COVID, that actually we have a real chance to shift how we practice our nursing with digital technologies that can really support us to do our work. But in order to do that, we need to think really critically about how we want to practice our nursing. What would be the education needs that are required to enable us to make the most of these opportunities? What are the opportunities for research if we use more digital technology and data science? And how does it affect the way we lead if we have access to all this data? And how might we want to lead differently in a world where we might be practicing quite differently? So the long-term plan, I've just put this in there. I know you'll all be merrily thinking about how you craft your applications. So I thought this was a useful context for you in terms of remembering what the long-term plan commitments are as you think about where to pitch your effort in terms of what you're doing. So this is one of the key areas you might want to think about. You know, is my project about digitization of an element? Is it about shared care records? You know, what would the nursing element of a shared care record look like? We clearly need to make sure that the fundamentals of nursing are in any shared care record, and think about that joining up of care across the system and where the opportunities might be. You may be thinking about projects about the workforce, or where people need help from the centre, and maybe thinking about small changes or apps, you know, thinking about the digital ecosystem and how ultimately it's our job at the centre to join that up, but we really want to create a vibrant ecosystem with lots of different technologies and lots of different ideas. Thinking about digital care plans and personal health records being available to our patients. And one of the long-term plan commitments here is that there's a CCIO or CIO on every board. One of the objectives here is to grow digital nurse and midwife leaders and AHP leaders, people that can use their voice, so that IO community grows in its breadth and in its influence. NHSX has 5 key missions. So if you're thinking about your what your application looks like, and you're thinking about doing a project around data and analytics, leaderships, or any improvement project, you know, what does it do in terms of ensuring people can access their information? What does it do in terms of reducing the burden or improving safety or putting patients in the driving seat? Or really importantly, how is it releasing time to care, increasing our productivity? So it's clear that we need the workforce with the requisite skills. So through doing this, I would like to think that you may be, through your project, growing these skills, or you're doing a project that would address these skills. So really give that some thought in your grant. And then thinking, I guess, I mean, COVID has been really challenging for us, and perhaps some of you are thinking about projects around resilience, and that would be fantastic. But if there is a positive side to COVID, I guess it is that we have necessity has made us really start to move towards using much more technology in our practice, and that's likely to be really helpful as we think about delivering the long-term plan and the whatever comes from the white paper that's out currently, but really thinking about place-based care, and this is where technology can support. So what's it, you know, can we do anything to support those that are working from home? I've just done a study about, I'm a researcher as well, about CNSs working from home during the pandemic. So, you know, is your idea about how you support them with that? You know, they've articulated quite different challenges when they're doing remote consultations. And those are some of the things that I think, you know, we are best placed to know what our own challenges are and opportunities are, and come up with new ideas for the way that we want to work work. You know, a CNS will often have a caseload like a doctor, but it's a fundamentally different role. So really thinking about the problems that you want to solve, be it for the worker like this, or for the patient as well, in terms of, you know, the opportunities we've had with video consultations, the remote monitoring with pulse oximetry has grown exponentially with COVID and been a real success and has really shown what we could do. How could you advance that further? Are there other ways that you would want to empower patients to remote monitor and send information in and manage them? I don't know. There are many, many opportunities, I'm sure, and each of you with your own hat, be you a physio, a nurse, a midwife, be you specialist in diabetes care or respiratory, you know, you all have quite different things. And what we want to see is applications that solve your real world problems and really advance your practice and support people in practice. And that's really what the CNO Priorities that I launched back at the CNO Summit before COVID hit us, just before we locked down in March. That's really what these speak to, I think. For me, this isn't about tech for tech's sake or data for data's sake, but how are we actually using it to advance and solve the problems that we have? So, you know, I would kind of use this as a checklist almost, you know, is this technology going to support anyone to join up care? So does it make data more available and more visible? It may do that. Am I reducing the burden? We mentioned the documentation burden here, but there are many other types of burden of duplication and rework that may be automated. Am I releasing time to care? Am I thinking about how I use the tech meaningfully in this task as part of an ongoing process to extend the humanity and extend that relational aspect of care? Does this do anything for safety? Can we do anything to reduce avoidable harms? These are key priorities for the profession. You know, we really want to think about new ways of thinking about how we manage the risk of pressure damage or falls. Importantly, am I doing something that's going to strengthen the evidence base for practice? You know, my ambition is to have big data. So that is tied to the ambition to have an interoperable standard, so a standardized practice so that we can collect that big data and it's not buried in silos. How would your project support that bigger ambition? How does it support clinicians having access to information that can enable them to target care, that might be part of some clinical decision support, but maybe about secondary uses like making leadership and management decisions or using it for research? Is this doing anything to empower people to actively participate in the care? I think it's quite interesting as we move beyond the pandemic to think about what will be different. I think some of it we anticipate, but some of it I'm not so sure we are anticipating yet or couldn't possibly foresee. But our public have had quite a different experience of healthcare and maybe a bit more taste of having different ways of receiving it, you know, less going to physically see a clinician and more remote monitoring. How do they feel about that? This is a good year for learning about some of this stuff, but also accelerating some of it. So is your project about putting the patient in the driving seat of their care? Importantly, in order to do all of those 6 things really and deliver good tech or good data science, there's a huge piece of work to be done around the professionalization of informatics, the support of the wider profession, thinking about undergraduate all the way up to get people much more comfortable with and knowledgeable around how technology may or may not support them so that they can come up with the ideas. So is your proposal about developing other clinical staff? And of course, the last piece is that professionalization piece. So, you know, I frequently, when I go to events like Rewired today, the IO community will say, we really want to be recognized as specialists You know, we have clinical nurse specialists in many different fields. For them, this is a branch of that. So those are all of the concepts that we'll be shaping out as we build the strategy in the coming year. And it would be really helpful to have a suite of outputs that come from these grant applications that might inform that way forward and contribute to some of those bigger ambitions. So for me, what's next is building community. I think it's been really interesting to see how that has a life of its own, and I am really keen that that happens, that this thing takes on a life force of its own, and we get a really vibrant and far-reaching constellation of networks where people are thinking about this all the time and are supported to do so. And it's so fantastic that the Burdett have taken forward and are inviting these grants, because that's part of building that community, that's part of building that collective endeavour. So for me, where I'm at the moment is trying to call many different groups to action to really maybe awaken particularly some of those today here, you're the digitally interested, but also those who aren't even thinking about that now. Although post-COVID, I'm not sure it's possible really to have not thought about it in some way, but really starting to get the whole of the professions to think, how do we want to work differently, and then how do we use people like the group in this room who are really driving forward the change to support us to do that. So I'm trying to champion the voice of nurses and midwives and AHPs actually at every level of the NHS, promoting networks and trying to think about how we speak with one voice. So last night I was on the CNIO network at Digital Health, and we're really encouraging that it's a network for everyone. So, you know, we have quite a number of AHP members, and I think that's really important that we do this together. We tend to have quite a lot in common, I think, particularly as we treat function rather than disease in the main. You know, we treat patients' functional needs and support them with those with whatever medical diagnosis they may or may not have. So I am calling for working with key stakeholders to train and educate and think about what training and education looks like in the future, with the professional bodies, with our regulatory bodies, to really start to shape that so that people are learning about this from an undergraduate level all the way through, and growing that advanced practice. And for you, I guess, well, what can you do? Well, submit a grant application would be fantastic. Make a change through using that money wisely to deliver a real change in practice, and generate that evidence base about what works and doesn't work in terms of digital transformation. Identify champions and support them. So support each other, I guess, through the process. Join networks, get involved, share information. And through doing this, we're going to do some wide engagement to build a digital strategy. So the aim is to build a roadmap for implementation, including recommendations for standard job descriptions, improvement metrics, the best bet technologies, the things that we need to focus on as a collective. And this Burdett's opportunity to apply for grants to make changes is really fundamental to that community building and the shaping of the strategy. That's all I have to add today. I hope that's been helpful in stimulating some thinking as you think about writing your grant applications. You can see there's a contact email address, and my Twitter handle's there. You're welcome to reach out if anything that I said resonates and you want to talk about it further. And what I'd like to do is wish you all good luck.
That was wonderful. Thank you very much, Natasha. And so helpful to hear your thoughts on the context in which these many nurses will be putting their grant applications forward. And that's one thing that's really important when they're making the application, is to explain why it's important now. And you've given us some excellent background there. So thank you so much. So I'd like to move on now to, thanks Natasha, to the change agents framework, as we mentioned earlier in the workshop. Now, CHIME, the College of Healthcare Information Management Executives, is a global non-profit, and I work for them as their Vice President International. And it is our aim to support digital health leaders everywhere with education, with networks, and finally with accreditation. But what we're going to help you with in this particular instance is education. So the first thing that happens when you accept your grant bid from Burdett is you get put onto the Change Agents framework on Ignite, which is our digital health platform. This is an annual subscription you'll have for 12 months. And during that time, you'll be able to meet other grant holders working in a similar area to you, so the cohort in which you're working in. You'll be able to access materials and also have a look around the whole Ignite site, which has a wealth of information and resources and other courses you can do. We call it self-paced learning. And so it's a great resource for you. And that's something that CHIME is giving to the Burdett grant holders to help them in their journey. Now, we worked out there were 3 areas in which digital health projects commonly fail. We did some research into this last year, and they were communication, project control, and the inability to consolidate that work and send it forward. So today, what we're going to offer you in the Change Agents framework is the chance to really develop in those 3 areas. So in communication, we'll be giving you ideas about how to explain your vision, how to win buy-in from your team and also from the senior leadership team in your organization. We'll be helping you with some strategies to encourage adaptive change in the places at which you work and how to develop your vision and ultimately your strategy for making your project work. Then we have control skills, and they are the basic project control and governance you'll need to use to make your project successful. And it's things like, when do you take action? How do you make that something that actually implements the work you're doing and brings it out of the realm of proof of concept and into something that really starts to drive change? And then finally, we talk about creativity and collaboration. And that's about 2/3 of the way into your project. How do you start making this future-proof, making sure it's got sustainability in it, and it's something that will make sure the gains you've made actually do carry on making a difference for patients. So that's a very, very quick overview of the Change Agents framework. Let me talk you through the timetable for this now. So in October this year, you will get your grant. Those who are successful will get their grant offers, and those who accept those offers will be admitted to Ignite, our platform, and you can start using that straight away. The grant program starts in January 2022, and in that month, we'll give you your first workshop, which will be on communication, as already discussed. In March 2022, we'll talk about project control as your projects start to get some make some traction, and how you're going to make sure that that lasts and is successful. And finally, in June, we'll talk about consolidating your work and making sure those gains are really felt by patients and in your organization. In October, we'll help you with your evidence, your data and your evidence, and how you write up those results and how you make that into the project into something that really has legacy in it. And finally, in December 2022, we'll be celebrating the work you've done so far, and also making sure that as you go forward, your work is recognized for what it did and how it made a change. So that's a very quick sprint through the Change Agents framework. I'd like to now go back to Shirley and ask her to talk us through the next steps on the programme.
Thank you, Jane, and thank you, Natasha, and all our speakers today. So the important news: applications are open from the 1st of April and can be made through the Burdett Trust website. And the application process will close on the 30th of May. The applications will then be independently assessed and go through various committees with the final recommendations made to the Board of Trustees. You will be notified in the autumn, and successful grants will start in January 2022. And the password that you need for your application is Digital One. Digital One.
Thank you, Shirley. So that's the conclusion of our workshop today. Thank you so much, everyone who took part. We just have a couple of final questions just to clear up a few issues. So first of all, there was questions about recording of this session and slides, and we'll be able to give those out to people.
Yes, we'll be able to give out a recording and the slides. Yes.
And the other question was about timings, and Shirley's gone through that.
Yes.
So the website will open on the 1st of April.
The application process on the website will be there on the 1st of April to the 30th of May. Yeah.
Wonderful. Okay. I'm just going to quickly just check if there are any more questions that have come up in this last few minutes. I think that's fine. Everyone's saying thank you. Yes, we'll give you a recording for anything else for your other team members. So that's all from me. I'm going to give Shirley the final word on this workshop. Thank you.
So thank you all for joining today, and good luck with your applications. Bye-bye.
Thank you. Bye.